Thank you, Pierre, for that very kind introduction. I'm really delighted to be here on behalf of the European Patients Forum. As Pierre said, we've worked very closely with IMI and Pierre's fantastic team in co-designing, co-creating, particularly the session on patient engagement, and it's a great thrill to be with you this morning. I'd just like to say a little bit more about the European Patients Forum to add to what Pierre's already said. We're an umbrella organisation, very, very inclusive, bringing together European disease-specific organisations across the disease spectrum, but also, crucially, national patient coalitions from very many of the EU member states. Our role is to be a united, collective patient's voice in the EU health discourse. And really, the two big pillars of our work are patient empowerment and equitable access to high-quality care. We've collaborated with IMI since 2010, and I remember making a presentation to the IMI Scientific Committee. Essentially, back then, we emphasised the importance of research with the patient rather than purely research on the patient. And of course, we can see much progress in the last 7 years. But there's still a long way to go. And I feel today we're really at a very, very exciting tipping point. Before homing in on patient engagement, just to step back for a moment, we should remind ourselves once again of the vast role and potential of IMI to engineer lasting change in the sphere of therapeutic innovation for the benefit of patients. IMI's focus on open innovation and societal impact means that we must work in harmony with other forms of health innovation: technological, digital, social, and systems innovation. We need more than ever to ensure health systems readiness to really embrace the societal challenges, not only for today, but for the future. With this shift in societal impact, IMI is increasingly addressing topics of public interest, in addition to the purely scientific work that's going on. And the consortia selected are producing through their project common goods which need to be trusted by all of the stakeholders to be neutral and fully credible. These projects are transformative and essential to the EU health and wider health sustainability agenda. And all this in the spirit of open science, a movement to make science, scientific research, data and dissemination accessible at all levels of an inquiring society, both professional and the layperson. Patients and the patient experience are, of course, at the heart of all of this, which is why a robust strategy for our involvement in IMI is so critical, and why it should ensure the continuum from patient engagement to truly patient-centred, patient-oriented policy and practice. Today's IMI Stakeholders Forum has two parallel sessions, one focusing on patient engagement and the other one focusing on microbiome therapies. This is a swiftly evolving area with significant implications in the research and regulatory environment. It's highly complex, it's a highly complex topic that needs to be carefully managed from both a cultural and a scientific perspective. Microbiome technology is a relatively new arena for patients. A deeper understanding of the gut microbiome could open new avenues for treatment strategies. But this requires quality information, education, and health literacy. But precisely because it is so new, it's also highly fertile ground to explore and implement effective patient engagement right from the onset and ensure that the patient's voice and the patient's experience is central to those conversations. And it would be really great if we could reflect on that, not only in patient engagement session, but also specifically in the microbiome session of today. So coming back to patient engagement specifically, of course, it's very much in vogue. It's very fashionable right now. There's no conference, big or small, related to pharmaceutical development or access to medicinal products where the topic isn't addressed or at least mentioned. And this is really thanks to the relentless efforts, the advocacy efforts of patient organisations across Europe. But there's also recognition increasingly across the wider stakeholder community of the added value of patient engagement in medicine's life cycle. They understand, you understand that intrinsically it's a good thing to do, it brings value, but then there are a number of barriers that we need to look at as well. In practice, its application varies hugely across stakeholders, countries and disease areas. And indeed, patient-centeredness is often approached quite superficially, focusing on patients' and citizens' choice and satisfaction, with really looking at user feedback as a tick box exercise rather than seeking a genuine patient perspective into the design. Moreover, there's a common recognition that engagement tends to be quite fragmented and piecemeal, with pockets of really great practice, real pearls of very, very good practice on patient engagement, but also, unfortunately, some examples of poor practice out there. Just to set the context of today's discussions in moving forward, I'd just like to share with you 3 examples of patient engagement in research from which I believe we can all learn. First of all, the HIV/ATG ECABs, the European Community Advisory Boards. They are really a role model. They were set up to achieve the fastest possible access to state-of-the-art medicinal products and devices and diagnostic tests that prevent or treat HIV infection or improve the quality of life for people living with HIV. And over the years, ECABs have effectively redefined the relationship between patient advocates, the scientific community, and the pharmaceutical industry. And just one example, the ECABs have achieved many, many amendments in trial protocols that were not, in the first instance, in the best interests of study participants. Another example from Germany, breast cancer survivors in Germany established the PATH Biobank in 2002 as a non-profit organisation to collect human tumour and blood samples, together, of course, with patient data. PATH involves breast cancer patients being the decisive force on which research projects are prioritised to get access to the biosamples. And in full transparency, PATH publishes the results of the studies performed with past samples on their website. By partnering with 7 academic centres, it's collected tumour samples from more than 8,000 patients. Importantly, PATH actually respects the proprietary right of the breast cancer patient. The patient donates their blood and tumour. In return, PATH reserves 1 aliquot of both blood serum and tumour tissue for use by the donor, and the donor may request these samples at any time, free of charge, further down the line to conduct diagnostic exercises on their own primary tumour. My third example comes from the area of rare diseases. Duchenne muscular dystrophy. This is the most common fatal genetic disorder diagnosed in childhood, affecting approximately 1 in 3,500 live male births. Because the Duchenne gene is found in the X chromosome, it affects obviously boys primarily, however it occurs across all races and all cultures. The United Parent Project was set up back in 2001 by 8 national Duchenne parent projects dedicated to finding a cure and viable treatments for DMD and to promote good standard of care across the globe. And the Duchenne Parent Project has actually been key over the years to redefining and driving the research agenda to identify therapeutic approaches in Duchenne. So 3 really powerful examples for you to reflect on. I'd now like to move to a particularly pet project and idea of mine, gold standard patient education. We know that meaningful patient engagement requires continued effort to really get to quality patient education in therapeutic innovation. And patients are not the only group who require training. All stakeholders can benefit extensively from education and training on how to work with patients effectively in a transparent, engaging, but also crucially impactful way. And this should never be a one-off ad hoc affair, but rather ongoing investment in an enabling environment, a little bit akin to continuous professional development, because learning is, after all, lifelong. With this in mind, I'd like to mention the European Patient Academy on Therapeutic Innovation, EUPATI, that Pierre referred to earlier, an EPF-coordinated IMI project, and I know that many people in the room have been involved, either directly or indirectly, in the project. EUPATI is arguably the most prominent example of patient capacity building at EU level, and during its lifetime, EUPATI achieved a great deal in terms of deliverables and outputs, but it was also a game changer in philosophy and attitude towards patient education. There's striking evidence showing that the EUPATI expert level training course made a huge impact, helping almost 100 patient advocates from 33 European countries to really step up their engagement in medicines R&D. The EUPATI multilingual toolbox has also made a major contribution, providing comprehensive, self-explanatory educational material for patient advocates in more than 7 languages. And the EUPATI toolbox to date has been used by 200,000 individual patients since its launch back in January 2016. We've also produced guidance documents on interactions between patients and industry, patients and regulators, and patients and the HTA community. And we've had strategic gatherings with industry and regulators to really reflect in a trusted environment on how we can really work together to ensure better outcomes for patients at the end of the day, with important conversations on issues such as conflict of interest, compensation and standard setting. To really reap the dividends, however, we should build on EUPATI. The demand is there, the need is there, but we need to do more with more patients in different languages. We also need to ensure information and materials are updated to reflect really the latest legislation and pharmaceutical policy, as well as scientific advances in medicines development. We need to upgrade and extend the current training content on medicines development based on the experience that we're gaining. And from earlier this year, at the end of the IMI project, EUPATI became an EPF-led multi-stakeholder programme in a much more modest format, but still delivering the course and so on, and entering a bridging phase while we look and endeavour to find a much more sustainable approach in the long term, exploring viable and ethical business models. So that's the challenge in hand at the moment in the context of EUPATI. From my perspective, patient education and patient engagement are hand in glove. Alongside patient education is the need for a much more systematic and structured approach to patient engagement throughout the entire life cycle of a product. To spell this out, it means right at the very beginning, or even before the beginning, actually working together on identifying unmet medical needs facing patients and their communities. The early stages of discovery R&D, early dialogue. Early dialogue is so key now in terms of better understanding across all of the players involved in the medicines R&D process. Clinical development, regulatory, HTA and health economic assessment, post-marketing monitoring, right through to real-world evidence collection and pharmacovigilance. The current fragmentation, lack of consistency and efficiency, and underrepresentation in the engagement of patients should be addressed by a uniform, standardised process throughout the lifetime of a medicine and deliver a set of unique and sustainable solutions for all of the stakeholders concerned. That means industry, patient organisations, regulators, HTA, the research community, academia, health professionals, but also, I believe strongly, policymakers as well. And we need to involve all of us together in moving forward in a meaningful way to develop this process. And I believe we can achieve this within the framework of the Innovative Medicines Initiative, within IMI. In fact, I believe it's one of IMI's quintessential roles. There's a need to align on what patient engagement really means for each of the different stakeholders involved within the medicines development community. There remain many quite important questions. Who is accountable? How to implement patient engagement meaningfully and ethically? How do we address the issue of management of competing interests and perceived conflict of interest or real conflict of interest? What can we do in terms of compensating patients fairly for their investment, their experience and their expertise? Can we create a label of patient investigator? This is, of course, a non-exhaustive snapshot of the current landscape. It's still very much in progress, and good patient engagement practices are yet to be a common denominator across the value chain. Achieving structured and systematic patient engagement in a sustainable and impactful way requires acting on systems readiness and building capabilities for engagement across all of the stakeholders, across 3 different buckets of activity. First of all, patient education and training. Secondly, the development of non-competitive tools for engagement and measurement. And thirdly, the sustainability of patient engagement in terms of concept, resources, infrastructure, processes, and competence. And only when all three of those buckets have actually been addressed properly will patient engagement really become the norm, not only today, but in the long term as we look forward. I'm hoping that this will be hotly debated and explored during the patient engagement session today, where we look at the return on patient engagement, crucially the metrics of patient engagement, and the crucial role of data and the digital agenda in driving forward patient engagement in an effective way. We're also looking at different models of patient engagement from which we can draw inspiration as we move forward. From my perspective, the financial sustainability question is possibly the hardest nut to crack. How do we move forward on a viable approach which all patients, all stakeholders can actually sign up to, believe in, invest in and trust? And I'm sure and I hope that that will be very much on the table today as well. Another important issue that's been broached in the context of patient engagement is the difference between the individual patient, the family and relatives, a patient expert of her or his disease, voluntarily taking part in activities, a patient advocate or patient organisation representative acting on behalf of a specific, well-defined constituency instructed organisation, and other networks such as online patient communities. The UPATI guidelines on this, developed with the patient community, will be hugely useful in clarifying respective roles of all of the patient individuals and representatives, experts and so on as we move forward. Let's look now briefly at patient engagement within the body politic of IMI. During an IMI workshop 18 months ago, we had the opportunity to really unpack what changes are needed in the governance of IMI to ensure that patient engagement is really embedded in its DNA. I believe we can really be inspired by the way the European Medicines Agency has engaged with patients over the last decade or so, also in its governance structure and the criteria that EMA has applied to patient organisations who are involved at different levels within the organisation. Legitimacy, representativeness, accountability, transparency. These are big, big words, but also huge, huge values that we need to take on board. Good governance should go hand in hand with ensuring patient engagement is visible as an element of relevant call topics, a criterion for the evaluation and review of our IMI proposals, but also in initiatives designed to ensure coordination, sustainability and exploitation. We and many others in the field of health research would argue that the success of key IMI and Horizon 2020 projects in the medicines development sphere is strongly dependent on patients. Patients who have their experiential knowledge and unique expertise as patients on what really matters for patients at the end of the day, but who also have vital knowledge and know-how on the therapeutic innovation process per se to really play their role and contribute most effectively. Without such patients, these projects really risk not to fulfill their potential. A good example is Adapt Smart, the EMA IMI coordinating and support action, which brings together relevant stakeholders, including patients, payers, HTA agencies, to explore how to advance on the concept of MAPS, Medicines Adaptive Pathways to Patients, with a focus on evidence generation throughout the entire product life cycle, designing an appropriate MAPS pathway, but also addressing key issues such as decision-making, sustainability, and ethical and legal implications. This brings really new challenges to the patient community and will require a new skill set to be able to engage effectively as an equal partner at all stages in the process, be part of the early dialogue that will influence trial design, endpoints, and expectations of regulators, HTA experts, and payers, and to really contribute effectively to the collection of real-world evidence, but also contribute to the kind of stewardship that real-world evidence actually requires. And EPF and our sister organisation, Eurodis, are actively involved in this project and will assess how best patients can be supported to really navigate appropriately this very exciting but quite challenging new terrain. Looking now at the international agenda, it's clear that we need to ensure that the IMI patient engagement strategy provides a conduit to developments at global level, notably the Patient Focused Medicines Development Initiative, or PFMD, which is an initiative that grew out of meetings of chief medical officers and patient groups, both in Europe and in the US, with an aim essentially to transform the way we understand, engage and partner with patients globally. But another piece of PFMD, and I think this is really important to reflect on, is how to provide the supports and the structures in regions where patient engagement is really way down here, really very much in its infancy. But there are many other really kindred spirit initiatives on patient engagement, both in the US and also in Europe. And as we move forward together, we need to optimise coherence and synergy and avoid duplication and, above all, competition. The stakes are really far too high for that. I'd like to close now with a reminder of some of the key messages on patient engagement that I hope you'll be able to take forward with you and think about during today's very, very intensive sessions, working sessions. First of all, we need to continue patient education within the framework of IMI, building on UPATI as a prerequisite for patient engagement. As I say, they go hand in glove. Second, the importance of addressing the gaps regarding a systematic approach to patient engagement in the entire product life cycle that creates the right sort of tools, the right sort of infrastructure, but crucially, the trust. Third, the numerous and doable ways we can embed patient engagement within the overall research agenda, prioritisation of research topics, the body politic and governance of IMI, and the critical important real example that this sets to the wider research community as a trailblazer in this space. And fourth, the importance of IMI in the health ecosystem at both European and global level, and patient engagement actually is an enabler for that to happen. This reminds me of the challenge of transforming the European Commission's approach to gender back in the late 80s and 90s. The women's movement was really smart. They pushed for a gender-specific programme that was, if you like, a springboard for mainstreaming gender in all policies. And this was to avoid gender being everywhere, but actually nowhere, and the approach being too opaque. In my mind, we need to do something similar in IMI. We need dedicated and specific efforts on patient education and patient engagement to provide that knowledge base, resources and support for all parties, and to enable IMI to mainstream patient engagement properly in all relevant projects that they undertake. This, I believe, will be instrumental in helping to embed patient engagement in the wider R&D environment, but also enhance its relevance and its resonance in the evolution of health, both at EU, European, and indeed at global level. So I'll leave those thoughts with you. Thank you very much for your attention. I'd love to pass the floor to Tamsin Rose, our moderator in the patient engagement session. Thank you very much.